As our public health experts have been warning for some time, we are now seeing the first locally transmitted cases of the Zika virus by mosquitoes in the continental United States. This was predicted and predictable. So far, we've seen 15 cases in the Miami area. We're taking this extremely seriously. Our CDC experts are on the ground working shoulder to shoulder with Florida health authorities. There is a very aggressive effort underway to control mosquitoes there, and pregnant women have been urged to stay away from the particular neighborhood that we're focused on. I do want to be very clear, though. Our public health experts do not expect to see the kind of widespread outbreaks of Zika here that we've seen in Brazil or in Puerto Rico. The kind of mosquitoes that are most likely to carry Zika are limited to certain regions of our country. But we cannot be complacent because we do expect to see more Zika cases. Congress needs to do its job. Fighting Zika costs money. Helping Puerto Rico deal with its Zika crisis costs money. Research into new vaccines. And by the way, NIH just announced the first clinical trials in humans. That costs money. And that's why my administration proposed an urgent request for more funding back in February. Not only did the Republican-led Congress not pass our request, they worked to cut it. And then they left for summer recess without passing any new funds for the fight against Zika. Now the money that we need to fight Zika is rapidly running out. The situation is getting critical. For instance, without sufficient funding, NIH clinical trials, and the possibilities of a vaccine, which is well within reach, could be delayed. So this is not the time for politics. A lot of folks talk about protecting Americans from threats. Well, Zika is a serious threat to Americans, especially babies, right now. So once again, I want to urge the American people to call their members of Congress and tell them to do their job. Deal with this threat, help protect the American people from Zika.